Many countries around the globe are gearing up for mass vaccinations to curb the spread of COVID-19, and there are calls to prioritize health workers who have been at the forefront treating millions of COVID-19 patients. Now, according to the International Council of Nurses, there is an 89% of nurse shortages in low and middle income countries, with women making up 90% of the world's nurses. Well, joining us to tell us about the mass vaccination campaign and the treatment of nurses around the world is Howard Catton. He's with the International Council of Nurses, the CEO there. He joins us all the way from Geneva, Switzerland. Mr. Catton, thank you very much for your time. As you heard in that introduction, here in South Africa, we're gearing up to receive the first batch of these vaccines on Monday. What should we be saying and doing for our healthcare professionals at a time like this? It is a very difficult time indeed for the world over.
Good morning to you. You're right that ICN, the International Council of Nurses, we called last year for healthcare workers, nurses and healthcare workers, to be prioritised for the vaccine once it was available. Just last week, the Director General of WHO warned that the world was on the brink of a moral catastrophe because of the unequal access to vaccines around the world. Out of the 40 million doses or so that have been delivered so far, only 25, he said, have been delivered in one low-income country. We need to prioritise nurses and healthcare workers along with the most vulnerable in our populations because they are at higher risk. The infection rates and the number of deaths amongst nurses and health workers is far too high. We know more than 2,200 nurses have died around the world from contracting coronavirus. But we also know that if we don't have nurses, we don't have healthcare, we don't have health systems. So we need to keep nurses and health workers at work to enable all of us to have access to health care. And that's why we've said very clearly, very plainly, that prioritising nurses and health workers globally, yes, that would mean that there are nurses who get vaccines in low and middle income countries before younger people who are not in vulnerable groups in high income countries.
Yeah. Before we talk about the mental health preparedness and the response of these healthcare workers in response to COVID-19, I just want you to give me an assessment as an organization of whether you think these low and middle income countries, which is what I understand my country to be, South Africa, middle income countries, do you think that we have done enough to support the nurses who have been at the forefront of this pandemic, or have we let them down?
I think right the way around the world, we have seen a lack of investment in nurses. We have a global shortage of around 10 million nurses. That's a huge number. We went into this pandemic with that shortage. And when people see the huge and relentless pressure that nurses have been under, that's starting from about 20-25% less staff than they should have already had. And we've also seen countries right the way around the world who just weren't prepared for this pandemic. They thought it wasn't going to happen. If they had thought about it, they may have done some paperwork exercises, but not made sure that as well as the staff, they had the equipment, they had the oxygen, they had beds, all of the things that we need, the equipment. PPE has been a huge issue as well. So yes, in Africa, in South Africa, but we see this around the world, a lack of preparedness. And what that means is a lack of hard investment in nursing and in our healthcare systems. And nurses and health workers are now the people who are in the eye of the pandemic, but facing the consequences of that. You mentioned mental health, that being one particular example that we're gravely concerned about.
The delays in vaccine acquisitions. That's something that we have been hyperventilating over here in South Africa for at least the start of January, pounding the government for the delays in acquiring these vaccines, because rightly so, they said once they get here, the first priority are the healthcare professionals, who include nurses. Do you think we should be to blame, our government should be to blame for the delays in the acquisition of these vaccines? Or perhaps I must also indicate here that our president lamented the developed countries doing what he said was the hoarding of these vaccines. He says, release these vaccines, the excess vaccines that you have, in order for middle and low income countries to benefit as well.
You're right. This is a complex issue, and I am certainly not going to point a finger at any one particular individual or government. We need to have sufficient supply of the vaccine. We need to have the supply chains in place to deliver it. We then need countries to establish the mass vaccination programs, to set up the centres, to have the staff, to ensure if it's got to be stored at a low temperature, that the supply chain is able to do all of that. That requires collaboration between individual governments in countries, but also between manufacturers, and collaboration between politicians at a global level. I think your president, I think, has a point, and a very important one, in terms of some high-income countries pre-ordering more stock than they need, may have resulted in an increase in price as well, and that then creates problems for lower or middle-income countries. And I would support the call for high-income countries to release more of the vaccine to low, middle-income countries. This virus does not recognise borders. It doesn't see lines on a map. What it actually does do is it exploits our inequalities. If we're not joined up, if we're not working together, we see that our most vulnerable are the ones who it targets. And what we're also seeing with this virus is that it is now mutating quickly. Sometimes we believe in a more dangerous way, and it is much more transmissible. The mutations have been more transmissible than the original virus. We have to fight this as one world. We will win or lose the fight against this virus as one world, not as individual nations. And we need the spirit of solidarity that we've seen amongst people and health workers around the world. We need that same strength of solidarity amongst the world's political leaders, in my view.
Howard Catton, I've got to thank you for your time. Unfortunately, I can't get to the question about the mental preparedness of these healthcare professionals, as we in South Africa here are in the middle of a second wave, and there's even talk of a third, fourth waves. But let's leave it there. That's another discussion for another day. Thank you very much for your time. Joining us from Geneva, Switzerland, the Chief Executive Officer of the International Council of Nurses. Let's take a short breather. We'll return in just a moment.